Okay, hello, this is Mirca Aceituno, and I'm going to be presenting the neurology ICU. So what can you see on this unit? So you're going to see a variety of neurological problems. This can be anywhere from post-op monitoring to tumors to traumatic injuries. It requires constant and vigilant monitoring as interventions might need to happen quickly and effectively. And the other side of this floor involves the patient's rehabilitation. So this can happen for both the patient and the family, and it is a huge and drastic change in some circumstances. So it's important to highlight this area. My transition to the neuro ICU, I've always had a pediatric interest, but I have grown to love to treat the patient at any stage of their life. So what are key issues? Hospital-acquired infections is what I've seen to be a increased risk for the patient due to the constant line monitoring that they have, and as well as devices. These are vital to monitor the patient at a continuous state. However, they increase the infection rate by 20%. And especially being a neuro patient, they have increased risk due to typically reduced mobility and urinary retention, which differs from other ICU floors. And a neuropsychiatric problem that I would like to highlight is the increased risk in depression and PTSD due to COVID-19 and how that has impacted the patients. Changes in interventions for hospital-acquired infections. These are inclusion of checklist based on insertion to make sure that all the steps are done correctly, even though these processes have been done multiple times. It's important to have a checklist. Doing daily reevaluations to see if the patients still need these lines and devices. Making research and using the best technology to detect these pathogens to start antibiotics as soon as possible. Using the antibiotics therapies that have shown greater effectiveness. I know that it's typical to use the combinations that are the prescriber is used to, but it's important to keep up with research to choose the best one. Changes in interventions for the neuropsychiatric portion, increase frequency of assessment tools. A study that I brought up in this presentation showcased that delivering home care over 3 months really reduced the likelihood of anxiety and PTSD of patients as they adjust to their new conditions. Alternating drugs that have shown during a traumatic period that can actually enhance during a post-recovery is crucial. And doing research in this can help the patient recovery. Implementing these sources would include providing, as a nurse leader, it's important to have education, and this can be through active team meetings as interaction facilitates memory and having interest in making this research. Having printed resources could also facilitate. Effectiveness communication would involve collaboration, open communication, and reassessment if these changes have showcased improvement based on application. Some barriers can include time constraint. Of course, everybody on the team is extremely busy and have a million things to do. However, keeping up with evidence-based research both enhances the care and the quality of care that the patient is receiving. Some lack of collaboration, again, having these meetings, the importance is to be interactive and making sure that everybody has their own input. And deem the importance, again, it's important to highlight the importance of maintaining up with new research, as the goal is to provide the best quality of care. And these are my citations. Thank you.